disease is what we all know as a disease that characteristically affects the extracardiac arteries, most commonly those of the lower limbs. Now, it is usually derived from any disease that causes arteriostenosis, usually a familiar sign of systemic atherosclerosis, and is often associated with an increased risk of death and even ischemic events. Now, how do we manage such a condition? Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to discuss about an autologous intramuscular injection that will help in treating peripheral arterial disease. Platelet concentrate contains a rich cocktail of growth factors that usually support the growth as well as the proliferation of the cells. Now, keeping this aspect in view, the primary goal of the study that I'm going to talk about in the Indian Journal of Medical Research was to investigate the safety of platelet lysate in patients with critical limb ischemia not suitable for standard revascularization procedure. Now, 7 patients in the age group of 18 to 70 years with critical limb ischemia were classified with a history of intermittent claudication for more than 8 weeks and were not suitable for standard revascularization technique. Now, all these patients, they underwent autologous intramuscular injections of platelet lysate, and these patients were examined physically alongside other parameters such as a toe pressure as well as the ankle brachial index at baseline and were all followed up for 12 months. The procedure was well tolerated with no serious adverse events reported during the follow-up period. So, although preliminary data did show significant clinical improvement in the ankle brachial index as well as the toe pressure, which persisted for the first year. So, the researchers hence concluded that the intramuscular injection of platelet lysate was well tolerated with no major adverse events reported in the study participants. So, with the observed satisfactory safety data, preliminary efficacy data of platelet lysate can be coded as an effective measure for patients with critical limb ischemia. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.